An apple a day. Brought to you by the Health Plan.
Smoking during pregnancy results in major changes on the developmental portion of the baby's life in utero, so that from the earliest start you may even have some genetic abnormalities to the child if you were smoking prior to you actually conceiving. But throughout the pregnancy, the smoking will further endanger the child by its growth pattern and by its development of certain organ systems, so that you may have babies affected throughout the course of the pregnancy, especially their size and their organ size. So it is not just that a baby is smaller if you smoke, its organs are smaller. If we get smaller as adults, we lose body fat. If a fetus gets smaller, it means its liver is smaller, its kidneys are smaller, and its brain is smaller. So smaller in utero is not good. Secondhand smoke can affect you, but it isn't as severe as smoking directly affects the baby. So that SIDS, or sudden infant death syndrome, is much more common in children who have been exposed to smoke in utero, but that also can occur if the house is a smoking house. So secondhand smoke does play a role in an increase in newborn deaths. If you're a smoker when you conceive, it isn't too late to make a change on the outcome of your pregnancy. So just because you smoked when you started doesn't mean you shouldn't make an effort thinking that the baby is going to be affected. You can reverse that trend if you stop immediately. You should participate in smoke cessation because it can decrease the incidence of the baby not growing appropriately if you stop in that earliest part of the pregnancy. Women should consult with their caregiver as soon as they realize that they're pregnant and have a smoking problem, so that you can speak to the caregiver, and there are multiple programs to stop smoking that they will help you with, whether it be medications, behavioral modifications. All of them have shown success in certain patients to stop the smoking habit so that your child will not be affected.
It's all a part of caring for yourself and your family. And that's what the Health Plan is all about.